How can you tell if a health influencer is legit or full of shit? Heel pain and footwear edition.
Some of the red flags to look for are, number one, they are trying to evoke very strong negative emotions, particularly as it relates to your health or the health of your children or your family.
Man, you know this isn't how we fix plantar fascia pain. Let me show you how.
No, when you've got someone claiming that they have all the answers and big podiatry or big pharma have been lying to you for decades, that is a red flag, especially when you couple it with a few of the other things that you're going to see in a minute.
Number two, they're making all or none statements.
You see, the main cause of this foot pain comes down to the shoes we wear. This means the first step to fixing plantar fascia pain isn't a stretch or an exercise, but rather needs to be addressing the cause, which for most means getting into a wider toe box shoe.
Now, when it comes to plantar fasciopathy, there are so many different risk factors that exist, which is why so many different people respond to different treatment interventions. Footwear is only one small piece of the puzzle. This is why you will have so many different people that can have the same diagnosis or the same condition, but they will have different responses to different treatments, because what is causing or contributing to their clinical presentation and the development of their condition, in this case plantar fasciopathy, it can be very different. Okay, what about narrow toe box shoes and the position it puts the big toe in causing plantar fasciopathy? There is no published literature available that really indicates that a narrow toe box shoe is a contributing factor for plantar fasciopathy. So him saying that it is the cause is completely inaccurate.
Number three, if they're selling you something that is related to the claims that they're making.
Introducing the greatest weightlifting shoe ever made.
Number four, if they have an obvious conflict of interest.
2 years ago, I teamed up with Tier to design the L1.
Last but not least, if they're speaking way outside of their area of expertise.
A lot of people wear shoes like this that are raised in the heel and raised in the toe. This basically puts the foot into a really bad position that stretches out the entire bottom part of the foot. So we're raising right here and elevating the heel. We've got a lot of stretch on the plantar fascia.
Incorrect. A higher heel drop, offset, or pitch actually decreases the amount of tensile load on the Achilles tendon, which subsequently decreases the amount of tensile load on the plantar fascia. And then when it comes to the flexed position of your toes in your shoes, your feet actually sit quite flat in a pair of runners, even if it has a very large forefoot rocker. It is because the rocker is part of the outsole and the midsole. So it's the geometry of the outside of the shoe that allows the forefoot to rock. And it is this footwear design characteristic that actually decreases the amount that your toes are going to flex in the shoe, because the shoe is doing more of that rocking movement, so your forefoot is not doing it. And this actually decreases the amount that your toes have to flex when you are walking and running, because the shoe is doing more of it for you. And because your toes are going through a reduced range of movement, there is less tensile loading being exerted on the plantar fascia when you're in a shoe that has a forefoot rocker and a higher degree of midsole bending stiffness. And you actually see this with one study where they were comparing barefoot conditions with shoes plus inner soles, and the amount of strain or tensile load exerted on the plantar fascia during running. And what they found was the barefoot condition had the highest strain loads going through the plantar fascia, and there was a reduction in strain loads when people were wearing shoes, and then a further reduction when people were wearing shoes and inserts. So points for trying, but he is absolutely incorrect.
Basically puts the foot into a really bad position that stretches out the entire bottom part of the foot.
So he's earned a big fat F for failing footwear and biomechanics. All right, let's put him to the test for anatomy, physiology, clinical application of research, and logic.
A recent study showed that when the big toe is pushed inwards, the same way it's positioned within many narrow shoes that we wear, blood flow to the lateral plantar artery of our foot is diminished, meaning that tissue healing is greatly decreased at the bottom of the foot.
Now let's have a closer look at the study he's cherry-picked to make his claims about the position of the big toe in shoes and it shutting off blood supply to the plantar fascia. The inclusion criteria was no lower extremity injury or pain in the last 3 months, meaning that no one in this study had plantar fasciopathy or plantar heel pain. And people were excluded from the study if they had hallux valgus or a bunion present. And then with the ultrasound imaging protocol, no one was wearing shoes or socks. The pre-imaging procedure, subjects removed shoes and socks and sat for 20 minutes. Then they laid down for 5 minutes to normalize blood flow. And then that is when they did the ultrasound assessment. So then how did they actually assess the position of the big toe? Okay, so researchers, after everyone had been sitting for 20 minutes, then lying down for 5 minutes, the researchers passively moved the toe into as much adduction as the person could achieve without pain or discomfort. And if they had to move the little toes out of the way so they could get into that full range of movement, they did that. And then they held that position for 60 seconds. Okay, this is where we can start to see a little bit of the logical fallacies start to creep into his argument regarding foot function, foot positioning, and footwear. The participants were lying down. They had someone else passively moving their toe into as much adduction as they could get into, pain-free, and then they were holding it statically for 60 to 90 seconds. Does this replicate what is actually going to happen to a foot inside a shoe when someone is ambulating?
Now, how does this relate to plantar fascia pain? Now, what happens is that when the foot is held for an extended period of time in an elevated and adducted position, a muscle called your abductor hallucis is pulled tight. And when it is pulled tight, the lateral plantar artery is actually pinched off and blood supply is limited to the bottom of the foot.
Here's a little bit of extra information that wasn't cherry-picked and shared with you. So, out of all of the participants that they were looking at with this study, assessing blood flow and positioning of the big toe, yes, 29 of the participants had that initial reduction in blood flow that immediately began to increase and normalize. So whilst the position of the big toe for that 60 to 90 seconds, it still led to a decrease from pre-testing blood flow, you still had a decent amount of blood going through that artery or tissue perfusion occurring because blood was getting into the artery and then it could perfuse into all the tissues around it. So nothing was shut off. But 16 of the participants actually had an increase in blood flow when the toe was moved into adduction. So it does not mean that the position of your big toe is going to shut blood supply off to anything and cause plantar fasciopathy. So for anatomy, physiology, clinical application of research, and logic, also awarding him a big fat F. This is what we call a false inference. This is where someone draws a conclusion that is not supported by available evidence or information. So it's essentially incorrect because it's derived from observations or reasoning that whilst the observation might be somewhat true, it's still false. So in this situation, we've got people who were lying down. Someone else was passively moving their toe into that position and holding it statically for 60 to 90 seconds. They weren't standing up, they weren't wearing shoes, they weren't moving around. So even the authors of these studies acknowledge that it was a simulation study of what could happen inside of a shoe to the blood flow in the foot. So it's suggesting that it might happen, and it is based on a theory. So they acknowledge that more work is needed because they cannot draw a definitive conclusion based on what they found. It literally lands at, this is what we found and it needs further information and research before we can say it does actually happen. This guy has drawn that false inference and made the claim based on information that falls short of allowing us to draw any definitive conclusion. Yes, footwear for some people, it can be a contributing factor, but it varies from person to person. For some people, more maximalist, cushioned and stiffer shoes can be a driver of symptoms for them, and they may find that going into a more minimalist or barefoot shoe therapeutically is amazing for them. But you flip a coin, because you can have other people who find that more minimalist barefoot shoes that have a zero drop, they are what actually provokes symptoms in them. So they may benefit from going into a more cushioned shoe with a rocker sole. That is why if you look on forums and support groups and everything that exists on the internet about plantar heel pain, plantar fasciopathy or plantar fasciitis treatment, the people, their responses and what's worked for them and what's set off their symptoms, it is so varied because there is no one definitive cause for this problem. There are dozens of risk factors that exist. So If you're a health practitioner and you want to learn more about managing lower extremity conditions, head to progressivepodiatryproject.com. Now, if you're a member of the general public, I love that you are here and giving me your time. I've recently started a new platform called Foot Pain Explained. Now, the aim of the game here is to try and help debunk much of the misinformation that exists out there on the internet and give you factual, evidence-based information so you can make more informed decisions about your body. And we just want to help you understand your body better. So you can follow us on YouTube, Instagram, or head to www.footpainexplained.com. Again, it's very early days with that platform, so I will be adding to it over time, but there is already a little bit of information there about plantar fasciopathy and plantar heel pain to help get you started.